participant of this great workshop that we'll be conducting on strengthening mental health and psychosocial support, integration into emergency preparedness and response. Colleagues, as you all know, this is timely, considering the fact that we are smack in the middle of COVID-19 pandemic response, and the fact that in this region in 2014 we had the Ebola virus disease outbreak, and in all of this we had to really activate mental health and psychosocial support in often challenging situations. And what we are doing today, what we'll be doing over this week, is a way to ensure a more sustainable outcome for the next pandemic or outbreak, which we all know is just a matter of time. It will come. So we will be starting the technical aspect. However, let me just alert you that we are expecting from the host country, Liberia, the top officials that will come. Once they come, we will break and do the official opening ceremony so that we now go back again to our technical activity. So we will save the official welcoming until our host countries and the officials are around, while we just start the technical component. So on behalf of the Director of Africa CDC, who really is interested in what we are doing today because of the importance of mental health and psychosocial support to emergency preparedness and response, I welcome you all to this workshop that we'll be having in the next 3 to 4 days. Thank you. Let me hand over to my colleague. But before I go, my name is Mohamed Abdulaziz. I head the Division of Disease Control and Prevention at the Africa CDC. I'm also the acting head of surveillance and disease intelligence for the same institution. Thank you. Let me hand over to Adelat, my colleague, to move us forward. And then, like I said, once the officials from our host country are around, we will break for the official opening. Adelat, over to you.
Yes, thank you so much, Mohamed, for this welcome and opening remark. As you say, we wait for the Honorable Minister to officially open this session. But as you say, let's continue with the agenda. So I'm here for the introduction. Let's start by a round of introduction, just to know each other. Let me start by myself. I'm Dr. Adela Kakunze. I work very closely with Dr. Mohamed in the Division of Disease Control and Prevention as the non-communicable disease and mental health unit lead. So we will let's start with from this side. So I will invite everyone to please introduce him or herself by saying the name and the responsibility, the role. Oh, it seems that okay. Let's start from here. Let's start from here, from the host country. Yes. Thank you.
We cannot hear. Could you speak louder, please?
I'm a sound in Montserrat County Health Team on the unit from Mental Health and Psychosocial Department.
Thank you. Before we proceed, can I check if the online they can hear us?
We are not hearing them clearly. We're not hearing them clearly.
Julian, can you confirm?
Good morning, everyone. I'm Mrs. Arietta A.B. Parker Salif, Hospital Administrator, ES Strength Mental Health Hospital.
Good morning. My name is Tanu S. Billy Jr., and I work with MSF as a mental health supervisor for the Epilepsy and Mental Health Project in Mosorado.
Good morning. My name is Angie Tayankun. I work with the Ministry of Health, Director for Mental Health and Substance Abuse.
Good morning. My name is Ansumana Kone. You can call me Ansu. I'm representing Ms. Kariatu Savage of the Ministry of Health. I'm also working for the government of Sierra Leone. I'm the social work coordinator for the National COVID Emergency Response Center. And we are delivering the mental health and psychosocial pillar.
Good morning.
Good morning.
My name is
Dawson. I work for the Carter Center. I'm the program lead for mental health.
Good morning. I'm Moses A. Tamba.
Good morning.
I'm the mental health.
My name is Jacobs. I work with the Ministry of Gender, Children, and Social Protection as one of the directors for the Department of Children.
Good morning. I'm Joseph S. Craig. I work for Ministry of Health. I'm the pharmacist for the mental health program.
Good morning, colleagues. Nice to see everyone. I'm Mohammed Abdulaziz. I head the Division of Disease Control and Prevention, Africa CDC.
Good morning. My name is Keseli Monimba.
Good morning. I'm Dr. Mengelimtina Justine Law, psychiatrist, responsible of mental health in Cameroon, head of psychological unit in COVID-19 response, and president of committee of the management of mental illness people homeless in the capital, Yaoundé.
Good morning. I'm Rosemary Moisaka from East, Central, and Southern Africa Health Community, a manager responsible for non-communicable diseases, food security, and nutrition.
Hello, everyone. It's a great pleasure to be here. After a lot of planning, it's wonderful to see you all, particularly our colleagues from across West Africa and one person from Central Africa. My name is Julian Eaton. I'm the assistant professor at London School of Hygiene and Tropical Medicine, here representing the UK Public Health Rapid Support Team. I also work for CBM Global.
Good morning, everyone. I'm happy to be here. I'm Mohammed Qasabi. I work with
Good morning to all. I'm
the support team as a mental health research fellow. Thank you.
Good morning, everyone. My name is Tumsani Jobo Mamba. I'm with the Africa CDC as the mental health technical officer. Thank you.
Yes, thank you, colleague, who are taking, who are here physically. So let's allow also the other colleagues who are joining online to introduce themselves.
Yes, good morning to all. I'm Moses A. Tamba, and Psychosocial Support Coordinator of the Liberia National Red Cross Society.
Good morning. My name is Lydia May Sherman. I'm the Deputy Minister for Children and Social Protection at the Ministry of Gender, Children and Social Protection, and also the chair on the mental health and psychosocial pillar, the designate lead. I'm en route. I have to open another workshop and I should be there shortly.
And I work for SOS Children's Villages in Liberia as the Child Protection and Safeguarding Coordinator.
Good morning. My name is Joseph T. Nyoko. I serve as MHPSS Program P Program Manager at the Action Against Hunger Liberia operation.
Good morning. I'm Sister Barbara Dean of Mother Patern College of Health Sciences and the co-chair to the Mental Health Task Force for the Ministry of Health and Social Welfare. Thank you.
Hello, everyone. My name is Sofia Rodriguez. I'm the Mental Health, Psychosocial Support and Protection Head of Department for Action Against Hunger.
And I'm the acting president for the Liberian Association of Mental Health Professionals.
Hello, good morning. My name is Aristide Foto. I'm a psychological support working with Dr. Mingini in Cameroon.
Good morning. My name is Fabien Mimon. I am a nurse specialized in mental health in Ministry of Health in Cameroon. I am specialized in health community. Thank you.
William Bosu, West Africa Health Organization, Burkina Faso.
Good morning. I'm Kemening Chi Kete. I'm a consultant clinical psychologist. I work with Anchor of Hope Counseling and Leadership Development Center. Thank you.
Good morning, everyone. I'm Betty Kawarega. I work with Africa CDC as NCD Technical Officer. Thank you.
Good morning. My name is Christian Alama. I am a mental health technical officer for WHO based in the regional office for Africa in Brazzaville, Congo. Thank you.
Thank you so much, colleague online. I think we have done, everybody have introduced themselves. So, colleague, we have 24 colleagues that are online. Thank you for joining. So I think now let's move with the agenda. Hope everybody have received the agenda. So as indicated, well, we wait for the Honorable Minister to do the official opening. But let's move on. Is it possible to bring up the agenda? Sure. Thank you so much. I think the colleague online can also see the agenda for today. So as I was saying, the official opening will happen later. Now we are into introduction. We just do the round of introduction, and I will ask the colleague here to write down the name on the tag, so that there's some pen on the table. So now I will go ahead and present on the objective of this workshop and what we want to achieve at the end of this 3 days. So you all have received the concept notes about this workshop. The purpose of organizing this meeting is to develop a comprehensive description and illustration on how the mental health and psychosocial support integration is expected to happen in the short, medium, and long term to contribute to the overall goal of strengthening mental health system in Africa, especially during emergency. And the general objective is to develop a theory of change that provides a strategic direction to mental health and psychosocial support integration into a selected national emergency preparedness and response plan. You can see that there are some selected countries based on the different experience in integrating the MHPSS into the national emergency response plan. We could not, unfortunately, invite all the countries that we would like to invite, but this is the pilot that we want to replicate in the future in other regions. So here we have, as you may have heard, we have Liberia, of course, will also be having experience from Sierra Leone. We have experience from Nigeria and Cameroon. And at the end of these 3 days, we want that lessons are shared and regional network are built between stakeholders that are participating in this workshop. And actual challenges and gaps for the integration of mental health in disease outbreak preparedness and response are really addressed. Action plan to address the barriers and achieve comprehensive inclusion of mental health emergency response is developed for the 4 countries. We have here the highest official when it comes to mental health in those those 4 countries. We want that the participant country are mobilized and committed to implement the theory of change and achieve its indicators. And we want, at the end of this workshop, that mental health focal points participating in this workshop are able to use the newly developed MHPSS minimum service package in planning and implementing MHPSS activity. Those are the key expected outcome, and you agree with me that is something achievable within these 3 days that will be convening here. So without taking too much time, I see my colleague is building the agenda and the working documents. But before we start, there's some ground rules. The first being that, you see, this is a small, it's a meeting, a small committee, so we want it to be participatory, and we want it to be interactive, and we want the attention of everybody. So we will really request everybody to avoid spending much time on the laptop. We know that we are all busy, but let's try as much as possible to really concentrate on this on the agenda. The second is I just want to show the participants who are here physically that the washroom are just behind this wall, just in case. Yes, and I think that we all have our name on the tag, so we'll be able to communicate easily. So let me now you all have received the agenda. So and participant online, maybe we can present it again. Let's adopt the agenda. If there's any comments, question, please feel free to raise your hand. But for the participant online, raise your hand. But for people here, just ask for the floor. Thank you. So I see no hands from our participant online. Colleague here, do we have any comments? No. So the agenda is adopted as it is. Thank you. And we would like someone to volunteer to bring the rapporteur for two participants to be rapporteur for this day one. Let's mix. Let's have one from the host country and one from the participant coming from outside. Dr. Angie? Okay. This is Dr. The name, please. Thank you for volunteering to be the rapporteur for today. And from the team from outside, coming from outside. From Sunny, why are you hiding? So, Julian, did you help to appoint? Dr. Law? Okay, thank you so much, Dr. Law. Yes, I think we are now going to start with the experience sharing from Liberia. Dr. Angie, are you ready? Okay, the floor is yours. Because I can't be
Good morning. Yes, so just a little correction. I am not a doctor. I am a registered nurse. with a master's in mental health. So that's just a correction. Okay, so all right, so I'm presenting on the state of, can you go back? Please, can you go back? Okay. So I'm presenting on the state of mental health and psychosocial support in emergency response in Liberia. And again, I'm Angie. I'm representing the mental health and psychosocial payload in Liberia. So before moving to the next slide, I just want to say that to the organizer of this very important workshop, that it was not a mistake to select Liberia as a host country. I know it's because of the experience that we have had in Ebola. And other response we have had, so Liberia was selected. So thank you for selecting Liberia as the host country, and also just want to take this time to recognize my bosses who supported us in terms of the response that we have had from Ebola and any other response that we've had. Thank you. So there's an outline that will guide us in our, sorry. Okay, sorry. So this is an outline, as I said, that will guide us in our presentation so that we can keep on track. Next slide. A brief overview of mental health in Liberia. And this is the mental health, the background of mental health, how it started, and how we have coordinated the MHPSS response in Liberia. There are a couple of documents that have gathered the establishment of mental health in Liberia as well as MHPSS. Just to point out, you can see on the board, Liberia is blessed that we have had a mental health law that is printed into handbill and is ready for dissemination. So we are working, the government is working with partners to be able to disseminate the information so that the entire country will know that this law exists, and we all can join hands to see how best we can support persons with mental health condition and psychosocial issues. And unlike other countries, Liberia offer a free health service delivery. And that is done in all public health facilities, including clinics, health centers, and hospitals. And there is not, MHPSS is also part of that. And it's a plus for us because when those that have mental health conditions, psychosocial issues, and go to these facilities, they are treated free of charge. So it's a plus for us. Next slide. So this is an institution. These are institutions that MHPSS partners are from. We will have named them one by one, but I don't want to make mistake to leave anybody out. So we have categorized this, where you have the land ministries that are part of the payload, the MHPSS payload. You have UN agencies that are also part of that, international and local organizations, faith-based institutions, and other organizations. So this is just to categorize it so that we cannot leave out anybody. Next slide. So integrating MHPSS into emergency response during the Ebola virus in Liberia. So some of us may have heard that the entire EVD outbreak affected the entire country. People died, a lot of people lost their lives, and it was very chaotic. But in an effort for the government of Liberia and through the Ministry of Health and partners to control it, you have the National Incident Management System was established to control that. And with the IMS, in short, it has various payloads that were used as working arm for the IMS. And MHPSS is an integral part of that payload. So the MHPSS payload was, at that time, during the EVD time, it was headed by partners. There are a lot of mechanisms that were put in place. Documents were developed to guide the implementation. As concerning the entire country, we have 15 countries. So we have documents that will guide the implementation of MHPSS between the response. So these are things that were done and was headed by the partner, as I said. So as the response began reducing, at the end of the response, the leadership of the MHPSS was turned over to the government of Liberia. And that, I think we heard earlier from the introduction from the Gender Ministry. My boss, who is the head for the MHPSS team, Minister Lydia Shema, she's going to join us later. So that at that time was turned over from the partner to the government and have been handled successfully from Ebola up to this time with various outbreaks. Next line. So this is some of the achievements that we had during the Ebola outbreak in Liberia. We couldn't have named all of those achievements in terms of integration, but there are a lot of things that we did, and it was the inner group. In terms of coordination, coordinating MHPSS activity across country with different sectors, different stakeholders that came together to work as a team. We can't achievement because we could not do it alone as Ministry of Health. We needed other people to come on board across the 15 countries, across other sectors. So we all work together. And one good thing was, as I said, is the decentralization of the MHPSS payload. We have the national the Montserrat County team where we sit now. But we have 15 countries in Liberia. And the issue of EVD, that is Ebola virus, took over the entire country. We could not sit at a national level and get documents just like that. We needed to work with the mental health clinicians and the social workers in the various counties. So it was decentralized. The payload, the MHPSS payload was decentralized in all of the countries. And as we needed documents, as we needed reports, because we needed to provide report data to the IMS that was headed by the minister, the Ministry of Health. So we have our staff in the various counties, the payloads that were providing report to the county IMS as well as the national IMS, and it worked very well. Next slide. Yes, so there's another achievement during the time of the Ebola virus. It's a very great achievement for us. Because during the Ebola outbreak, people got affected, people got infected, those that got healed from the condition. Majority of them started to develop sequela. They came down with a lot of conditions. And in that way, the government, through the partners, in collaboration with the partners, there was a need to have a system in place, to have some unity in place. And with that, the Ebola network, survival network was established with various categories for position in order to respond to these brothers and sisters, mothers and fathers that came down with different conditions as a result of Ebola. So there's a network that was established and has sub branches in various counties. So it was an achievement for us because we were able to control and work directly with those that have these various conditions, and where we were also referring them to hospitals for treatment. So on the other hand, the issue of child protection came in. Children needed protection. There are children that lost their parents, caregivers, relatives that were taking care of them. They even had other conditions that they needed to be cared for. So with that, the MHPSS payload had some assessment and knew that there is a need to have something in place. So an interim center was established that children that needed this complete special care were taken care of, taken to this area, and they were cared for, and it was a very success story for us. So next slide. So with the experience or achievement from Ebola virus, it also helped us when Corona came in. When Corona came in, those experiences that we had the payload already established, so we needed to reactivate the payload, and that was done with the leadership now, with the government. It was well organized. We have the documents that need to be revised, so we enable us to move fast, and these are things that were done with support from partners. So these are things that we did during the Ebola coronavirus. We also had the interim center as well that children were taken care of at the appointed time. Next time. MHPSS in other emergency disaster. The MHPSS payload also respond to other conditions. Other than disease outbreak, other than viral outbreak, other emergency situations that have happened in Liberia with the payload is set. So this is I was just there to welcome the minister that just walked in, the Minister of Health, and I think she will allow me to finish my presentation so that. Thank you, Minister. All right. So as I said, the payload do respond to other disease condition, other emergency outbreak, and this payload is unique that since most of the time when there's a response and when it's reducing, in most cases, our meetings have been reduced. The frequency of the meetings will be reduced because the outbreak is ceasing down. But with that, we have a system, the MHPSS payload is such a way that is uniquely organized that there's a chat room, and almost all of the MHPSS members are part of that chat room. Our bosses are part of that chat room. Our officials are part of the chat room. So in any outbreak, as you can see on the post, school shooting, church disaster, fire disaster, children issue, any emergency situation that happens in country, the payload is light through the chat room, and there's a team, there'll be a team set up to respond coordinate. So with or without disaster or emergency, the payload exists, and there's constant monitoring of the chat room. So next slide. So with all of the good things that we've just said, there are always a challenge. There are some challenges that you have to always find a way out. So for Ebola, those challenges for Ebola, yes, we can see them on the screen, but for coronavirus, it was a serious challenge because we all know that Ebola was localized. It was in a specific countries, few countries, but just in Liberia and other countries here surrounding. But for coronavirus, it was globally affected. So as a result, the issue of funding, it was a challenge for MHPSS in Liberia. It was not just Liberia that you will see because of during the EBD time, support came from everywhere. But for coronavirus, it was very limited, and as a result, the payload also suffered that. Next time. So the lesson learned, what are the lessons that we learned from Ebola outbreak and from coronavirus? So as I think I said earlier, the issue of collaboration is key. The issue of working together when it comes to consultative meetings, implementation with partners is a very crucial one that we better take into consideration. The issue of human rights approaches that we should be effective. What do I mean? That is, for example, you work with people that are infected, either the patient, family members, community members, and make sure that you listen to them, sit with them, listen to them, respect their rights, and be able to address whatever need that they have. In that way, they feel part of the system, they are ready to help, they are motivated, and they are all on board, because from Ebola, we realized that engagement, community engagement, working with the community, we achieve in this country. We realize that community play a very crucial role. You will not leave community members out and work at the national level or in our various offices. So that was a serious lesson we learned, and that lesson also go over to coronavirus next time. So best practices, what are the best practices that we have from all of the various emergency that we've had, disaster, and all? Yes, so those methods and techniques that we used during the Ebola virus were accepted, and they gave us good results. So those best methods that we use, we now use it as a standard way of approaching and responding to a disaster. As I said earlier, we have the chat room, we have our team, the NHPSS team, and in case of any emergency, there's a signal, and also the issue of working with community members and not leaving anybody out and work at the national level. So we make sure that we involve everyone, including our partners. So these are best practices that we have used over the time that taught us from Ebola up to various smaller emergency and up to coronavirus. Next now. So these are just the abbreviations, just in case you need to want to know any resource material. And then, thank you so much for your attention. Can I stay for question or sit?
Yes. Thank you so much, Angie, for the excellent presentation. So let me call Dr. Mohammed and Professor Julian to come here to join the Honorable Minister of Health for the official opening of this workshop. So, calling online, we will now proceed to the official opening. We will take the question after. Thank you. So, as you can see, we start with Dr. Mohamed Abdulaziz, representing the African Union Commission and the Africa CDC for his introductory remarks. Dr. Mohamed, over to you.
Your Excellency, the Minister of Health, Your Excellency, the Minister of Gender, senior staff of the Ministry of Health, Liberia, partners here present, distinguished participants of this workshop. On behalf of the Director of Africa CDC, let me officially welcome everyone to this workshop that seeks to focus on how we will integrate mental health and psychosocial support into emergency preparedness and response. Just last week, Your Excellency, in Addis Ababa, the African Union Summit, where all the head of states of the African Union converge in Addis Ababa, including the president of this great nation, Liberia, took a momentous decision to make Africa CDC an autonomous health agency of the African Union Commission. That was a great decision that was taken by our head of states. And what we are doing today, Your Excellency, is to begin to move very purposefully so that the trust given to Africa CDC and other institutions by our head of state, we begin to earn it. It's not every day that the head of states give this kind of endorsement to an institution, and it shows the level of commitment at the highest level of leadership in the African Union to the health of Africans on the continent. Let me take you back into memory lane to also say that Africa CDC came to be in 2013, really, when the head of states decided that they needed a public health institution, a continental public health institution that will work to ensure that the diseases that are the biggest burden for Africans are taken care of. That time, they were thinking of TB, malaria, and HIV, and even mental health, which are the biggest burden of diseases. And then that led to Abuja Declaration. But in 2014, we had the Ebola virus outbreak in West Africa. So it shifted the attention of the policymakers from endemic and diseases causing the biggest burden to global health security. And that was why when in 2017, Africa CDC came into being, the attention was on emergency response. But subsequently, during the pandemic in 2020, Africa CDC decided to operationalize the division that is responsible for non-communicable diseases and mental health, which is the Division of Disease Control and Prevention. So with that, the new division began to work purposefully to address issues that has to do with mental health. And we